and Colorado-based nurse Lisa Merck, who actually had the coronavirus. Lisa, I'm going to start with you because you've been on the front line. You've suffered from this. You recovered. We hope you're doing okay. Give us your take when you see something like this going on.
It makes me really sad. I'm doing much better now, but we need to protect our healthcare workers. That's the biggest thing: lack of testing, lack of PPE in some areas, crisis areas. I think it's a huge issue. It's really dangerous and it's really careless.
Mike, we saw a video actually of a nurse actually protesting protesters in the Denver area. Can you just give us an idea? Obviously, if even a nurse in the time off is willing to go out there and make a statement, this is obviously a dire situation.
Yeah, I mean, so we know the nurses on the front line of this, especially the emergency room nurses. I mean, we've been facing this since it first hit, within the U.S. here. And so the nurses, I mean, we want to be able to care for our communities. We want to be able to stay safe. And so we've done our parts in help educating our communities to let them know that we need their help. We are all in this together. And the only way that we're going to get through this is by being in this together. So, just as Lisa said, we all still need a PPE. We need that testing so that way we know who's testing positive, and so that way we can make sure that we have them quarantined to make sure our communities stay safe.
Yeah, Lisa, it kind of breaks my heart to see the kind of protest and the clashes in Colorado over the weekend, because I'm all for people who want to get back to work. I've been a small business owner. I completely understand that. But also there are nurses out there that are putting their lives on the line. At what point did they conflict? It seems like they could all work together. We all want people to be safe and to go back to work.
The problem right now is lack of testing. Only some healthcare workers can get testing, others can't. I've been very, very fortunate that I've been able to get retesting. I've had 7 retests, but I've also stood my ground too and been an advocate for myself and my patients, as well as my community members. So I'm following a healthcare test-based strategy where I want to have my 2 negatives before I go back to work. And although it's been really hard for me, I've been on isolation almost 44 days now.
Oh,
Today's
my.
44.
How are you feeling? Are you doing better?
I'm doing so much better. I really am. And I just started probably about a week and a half ago feeling really good. I have my energy back. I can breathe better. But, my first negative test came 41 days after my initial positive test. So that's the thing that I'm really worried about, is healthcare workers being put back into the front lines, back into the ERs, back into the clinics, working when we don't know if we're truly shedding the virus and spreading the virus. And that's the key. Like our first responders, our healthcare workers, we have to be tested, antibody testing, PCR, to get us back to work safely.
Mike, any parting thoughts for us?
Yeah, I mean, just, we want to say thanks to the community. We have had a lot of support from the communities to show their appreciation to the hospitals during this time. So we definitely want to say thank you for that. The Emergency Nurse Association has actually created a fund to be able to help some of our nurses out that have been impacted by the coronavirus. So if anybody wants to go to ENA Together, there's a resource page there that you can help donate. And there's also just a virtual board that you can send thanks messages to the frontline healthcare workers that are on the front lines fighting this pandemic.
ENA Together. Got it, Mike. We want to say thank you to all of you putting yourselves out there every day.
Yeah,
Mike,
thank you, Lisa.
Yes, and Lisa Merck, thank you so much for joining us.